this picture that you see out here, the function, sorry, okay, cells, glial cells, which are the neuroglia. And if you look at the neurons, they have cell bodies with processes. One process would be the axon, and the rest would be dendrites, which have branching patterns. So you can see these branches, these are the dendrites, and the axon would start from the neuron, which is called the axon hillock. If you look at the nucleus, it's a large nucleus, the distinct nucleoli. These cells are always, mostly if they are active, they are in a euchromatin stage. If they are active, if they are not, and you can see the cells, these cells that we are seeing are all multipolar cells because they have multiple processes. You'll be seeing tomorrow, there'll be a class on histology of nervous system in which you will be doing all this and everything will be explained to you. And the supporting cells out here are called the neuroglia. And the types of neuroglia, types of neurons, the processes, all that will be covered in your histology classes. So wherever we have aggregation of the cell bodies, it forms a condensed dark area, which we call as gray matter. And where the processes are there, we do not see any cell body, that's called white matter. So the functional unit of the brain is a neuron. Now, what does the brain do? Brain just processes. It's a big computer which processes our stimuli which are coming, the sensory stimuli which are coming. These are the afferents, comes to the brain. It comes to the brain and then it goes out to the efferent, to the effector organs or muscles or whatever it is by an efferent pathway. So there is an afferent pathway which is sensory. There is an efferent pathway which is carrying the order from above, and there's something which is memory. What is it? I give you a small example. You know, each one of you know, if there is a fire and you put your fingers against the fire, your hand against, it's going to burn. But if we take a small child who has no idea about it and he just touches some hot object or fire, is going to burn. We all know, and this is processed in our memory. So the memory retains our whatever, whether it is a pleasant memory or an unpleasant memory, it is all processed there in our brain. Even recognition of a person, recognition of voice. You now have seen me, so you can recognize me. So it's in your memory. But of course, nowadays we are not seeing anyone, so it's not there. But still, we know the voices. We know our loved ones. We can recognize them. We have pleasant experiences. We have unpleasant experiences. They are all stored in our memory. But immediately, afferents would be that we've got a impulse which is an unpleasant impulse. We've got a bite by a mosquito bite. Immediately what will happen? The other hand will come and try to hit the mosquito. So it's very, very fast. This is a processing mechanism which is going faster than a computer. So the brain is lodged in the cranial cavity. It's lodged in the cranial cavity, and as you can see, this is it's a picture which is in fact showing things can be seen because it's processed like that, and we'll come on to what it is. So the nervous system is divided into a central nervous system which comprises of the brain and the spinal cord, and a peripheral nervous system which are the peripheral nerves. In the head and neck region, you've already done head and neck region, so you know that the peripheral nerves in the head and neck region are the cranial nerves, while in the rest of the body, the peripheral nerves are the nerves which are supplying the limbs. They're supplying the rib cage, the abdomen. Out here, they'll be from the brachial plexus. In the lower limb, they'll be from the lumbar plexus. Here in the thoracic cavity, they would be the intercostal nerves. Similarly, in the abdomen also, we'll have the lumbar plexus. So these would be the lumbar and sacral plexuses would be the ones which are supplying the body, and besides that there is another nervous system which is called the autonomic nervous system, which is not under our control. It is controlled by the sympathetic and parasympathetic. Sympathetic is the one which is working during emergency, during fight, during flight. That is the it's works during going through the auricular temporal and going and supplying the parotid gland, right? So here auricular temporal is carrying the postganglionic parasympathetic fibers, and we have not told it told the aortic ganglion to work. We told the ganglion or dilate our pupils. It's all by autonomic nervous system. Our heart beats. The parasympathetic slows the heart, the sympathetic increases the heart rate. We are not telling it, goes on. Similarly, in the GIT, we have the enteric nervous system, again, which is not under our control. They are involuntary. So we have, broadly, we now say that we divide the nervous system into a central nervous system and a peripheral nervous system. At the end of these lectures, we'll do a class on autonomic nervous system when we finish with the brain. So the human brain at birth is about 400 grams. So you can see the amount of weight that the brain is having at birth. While the baby can be about 3.5 kilos, the brain is about 400 grams. By 3 years, it's almost 1200 grams, almost adult size. While adult brain is 1100 to 1700 grams. That means the brain has an exponential growth during the infancy. A child learns things very rapidly, absorbs everything that is like a sponge. Everything comes in, and gradually by the time we are mature, synapses are forming, more nerves are forming contacts with each other. Our brain processing is happening. So that continues. This brain processing, the neural processing continues almost by the time we have reached our maturation, that is we are about 16, 17, 18, our brain starts growing. By 25 we said yes, much more mature, able to do a lot of functions, and by 50 there is slight decline in the brain. So then it's not working. It's not true of the nervous system. If you start working with your brain, you do not let it go idle, you can function very well. That's the reason why your longevity also increases. So there are about 10 to the power 10 neurons in the human brain. So you can imagine the number of neurons that the brain has, and neuroglia are the supporting cells. So this is the brain, and this is the brain which I am saying. Actually, the brain means the portion that you see out here is the cerebrum, or we say the cerebral hemisphere. And below this small structure that you see, this is the cerebellum, and you can see a stalk-like structure coming down. This is the brainstem. Gradually, as we go further, I'll be explaining each and every part of the brain. Now, the cerebral hemisphere if you see, this is the only way that the human beings are different from the other species or other mammalian species. We say that the human beings have got the most intelligent animal in this animal kingdom. Why? Because they have intellectual property, they have have language, which is something which is not there with lower animals or primates. We say primates are also evolved in the evolutionary tree. If we say they are also evolved, but human beings are the maximum evolved creature that is there in this planet. They have number of information. Everything is stored in this cerebral hemisphere, the highest center, or it's also part of the neocortex, the new cortex. In animals and all, it's a much smaller part. So what happens, because it has to store so much of information and so much of data, it's a processor. To accommodate all that, the surface forms into these elevations and depression, thereby increasing the surface area of the human brain, which forms these sulci and gyri. The depressions are called the sulci and the elevations are called the gyri. So the entire cerebral hemisphere, if you see, is composed of sulci and gyri, and gradually as we go beyond, we'll be naming these sulci and gyri. So it looks like a walnut if you look very carefully, and these elevations are called gyri, and the depressions are called gyrus, elevation. Sulci are sulcus, depressions. So this is the cerebral hemisphere, which we are seeing from the inferior surface. The inferior surface means this surface that we are seeing is the surface which when we take it out from the brain, this is the way it's going to look. This is one side of the cerebrum. We call it the cerebral hemisphere because it's one side. Two sides together would form the total complete cerebrum. This is from the cerebral hemisphere, that is the other side of the cerebral hemispheres, and they're connected in the midline. I'll be showing you also how they're connected. So what happens in the cerebral hemisphere? They are lying in the rigid box, or we say the rigid to the anterior cranial fossa. So in fact, you people should be deciphering what would be the bones which would be coming against this part. So obviously it will be the orbital plate of the frontal bone. There will be the lesser wing of the sphenoid. This portion would be having the sella turcica, the zugum sphenoidal. All these, this would be having the center part, would be having the cribriform plate of the ethmoid bone. Then we have the middle cranial fossa, which would be having the greater wing of the sphenoid, and then you have the petrous part of the temporal bone coming in the middle cranial fossa, and the posterior cranial fossa, if you see, would be having the part of the occipital bone. This is the brain stem. This is the brain stem, which has one part which is called the pons. This is called the medulla, and there are two peduncles. Peduncles are white matter bundles which are called the crus cerebri, and this is called the interpeduncular fossa. In that there are two swellings which are the mammillary bodies. We are not going to talk about them now, but just see the structure. This is the medulla. This is the medulla oblongata. This is the pons, and this is the cerebral hemisphere. This is the midbrain. So midbrain, pons, and medulla are forming the brain stem. This is the cerebral hemisphere, and in between this would be having the diencephalon. I'll come to that in the subsequent parts. So let's now classify the central nervous system, that's the brain, which has three components: prosencephalon, mesencephalon, and rhombencephalon. Or we say forebrain in common language, midbrain and hindbrain. So the forebrain or prosencephalon has two parts, two components. One is called the telencephalon, the part that is exposed that you could see out here in the above diagrams are called the telencephalon, and diencephalon is the part which has thalamus and hypothalamus are hidden between the cerebrum. They are condensed nuclei groups of the cerebrum. That's why they are deep-seated inside the cerebral fibers. So it has the diencephalon, which has comprises of the thalamus and the hypothalamus. Mesencephalon is the midbrain, and rhombencephalon has the part which has the metencephalon, which is pons and cerebellum. This, what you see out here, is there are no sulci gyri. There are fissures out here which are increasing. Okay, so I don't show the arrow. Network की problem हो रही है. Just a minute. Okay. नेट नहीं आ रहा.
उतना अच्छा नहीं आ रहा. उसकी वजह से ना वॉइस स्पीक में चली जा रही है. जब आप पॉइंटर जिस पे लगा रहे हो वो दूसरा मैच नहीं.
ओके, तो क्या करें?
क्या करें? नेटवर्क
नहीं. So if network, let me just ask the students now. Okay, I just asked one girl out here जो है अग्रवाल. दिशा अग्रवाल और गौरी. Where is Gauri?
Yes, ma'am. Your voice is breaking.
नहीं कर रहे. ये wait कर. My voice is breaking. There is a network issue today.
Yes, ma'am.
So could how much could you hear me?
Ma'am, mostly, but no, ma'am, just
Just
like every other like fifth, sixth word goes missing.
yes, every. I can't hear her also.
Ma'am,
Yes,
like
I
every
can't hear
fifth.
you also. So
Yes, ma'am.
ऐसे ही होगा क्योंकि आपकी वॉइस भी ना बीच में
हाँ बोलो.
Ma'am, like every fifth or sixth word
बताओ.
goes missing, but we are able to understand.
ऐसे कंटिन्यू कर लूं, फिर कल फिर करूंगी क्लास, उसमें फिर ये सारा बता दूं. Continue like.
Yes,
Because
ma'am.
now it is basic, so let me go on. And tomorrow I'll just repeat rapidly what I have done today, because anyway I'm not touching much of the study part. It's just revision. It's a recap, right?
Yes, ma'am.
Is it okay?
Yes, ma'am. Yes, ma'am.
Because right. Because anyway there's a network issue. I'll do it from home tomorrow. यहाँ पर department में ही problem. ठीक है. So if there is any problem, please unmute yourself and answer. Okay, tell me, because I'm
Yes,
not
ma'am.
playing recorded lectures, so that's why हो
Okay,
सकता
ma'am.
problem. But anyway, transmission में भी तो problem हो ही जाता है. चलो,
Yes,
let's
ma'am.
continue.
Thank you,
So rhombencephalon is the part which has metencephalon and myelencephalon. Myelencephalon is the medulla oblongata. This part, this is the pons, which is metencephalon, and this is the cerebellum. And you can see that there are fissures out here, horizontal fissures, instead of sulci gyri, to increase the surface area. क्या हो गया? Now look at this picture. This is again the same, the inferior surface of the brain. And here what you can see that this picture, they have numbers on them, right? So these numbers are actually the cranial nerves. Okay, so the cranial nerves means these nerves are emerging from the brain. So the first cranial nerve is the optic. So number of nerves come out from the cribriform plate, about 10 to 12 on each side, and they form the olfactory gyri. This is the olfactory tract lying in the olfactory gyri. So this is the olfactory nerves, and this is the olfactory tract, which would be forming its course in the brain. So this is first optic nerve, sorry, the olfactory nerve, the first cranial nerve. The second cranial nerve is the optic. So see this is the optic nerve. You've read the optic nerve. Where does it, how does it come out from the eyeball? Through the optic canal. So this optic nerve is forming the optic chiasma. You can see this. The third nerve would be coming from the midbrain. So this is the pons. Uske upar we have the midbrain. These are the crus cerebri. On the ventral surface, it's coming out. This is the oculomotor. The fourth nerve is the trochlear nerve, the thinnest cranial nerve, and the only cranial nerve which comes from the dorsal aspect of the brain. So this is the trochlear nerve. So third and fourth are coming from the midbrain. The fifth nerve, the sixth nerve, they come from the pontomedullary junction. This is the fifth medially. Laterally we have the sixth, and more laterally we'll have the seventh and the eighth cranial nerve. The seventh cranial nerve and the eighth cranial nerve are the most laterally. So in the pontomedullary junction at the center you have the fifth and the laterally sixth, and at the cerebropontine angle. Cerebropontine angle is the seventh and eighth cranial nerve. Seventh being the facial, eighth being the vestibulocochlear are coming from this angle. The 9th, 10th, 11th will be coming from the posterolateral sulcus, and the 12th comes from the anterolateral sulcus. So these are the 12 cranial nerves, and how they emerge you are seeing from this. Now that you have done head and neck region, it's going to be much easier for you to correlate them. And now what we are going to see, we are going to see these nerves, how they are coming out from the brain. We'll be doing that also, doing the functional columns of these cranial nerves to find their source or origin from the brain. Most of these cranial nerves come from the brainstem, excepting the first and the second. So from 3rd to 12th are coming from the brainstem. First is part of the olfactory, and second is the optic, having special senses. So this is the cerebral hemisphere, which I had told you. This is the cerebral hemisphere. This is the laterally we are seeing this, and this is the medial surface of the hemisphere. So this is the medial surface, this is the cerebrum, and immediately you can see here the texture and structure looks different. This is part of the cerebellum, right? This is the part of the cerebellum, and this is the part of the brainstem. Now if you see very clearly, now that it has been cut open, what do you see? You can see a narrow cavity which is lying inside the brainstem near the cerebellum, near the medulla and pons. It forms a tent-like structure that's called the fourth ventricle. This is part of the diencephalon. And also inside the cerebral hemisphere, there'll be fluid-filled cavities which are called the CSF. So this is the spinal cord, and this is the brain, and they have been colored out here. So the anterior part of the brain is called the frontal lobe, the middle part is called the parietal lobe, posterior part of the brain is called the occipital lobe, and inferior part is called the temporal lobe. Okay, and this is the cerebellum. So the cerebrum is also divided into different lobes. We'll come on to that, how they are divided. So in the center, just away from the midline, there is a sulcus which is coming at an angle of 45 degree. It's not a complete sulcus. This is called the central sulcus. If we draw a line from here and bring it to this lateral part, which is called the lateral sulcus, between the upper part and the lower part of the brain, there is a groove out here on the lateral side, is called the lateral sulcus. Join an imaginary line of these two. We have divided the brain into anterior part and the posterior part. Now this is the anterior part of the brain. How do we see? Because the anterior part is more rounded. The posterior part has the cerebellum with it. So this is called the frontal pole. The posterior point is called the occipital pole. The inferior part is called the temporal pole, right? So from this is frontal pole, this is occipital pole, this is temporal pole. Now if I draw a line, imaginary line up to the lateral sulcus, this first part is all the frontal lobe. Now this is the occipital lobe. There is a notch out here. I say this is the pre-occipital notch. I draw another line up to this part. This is sulcus out here, which is called the parieto-occipital sulcus, and that sulcus would be called as, so if I draw it like this, that is called the posterior part is called the occipital lobe, right? Now this central sulcus को भी मैं पीछे ले आती हूँ ऐसे. I'll just, sorry, I'll try to draw this also up to the, नहीं दिख रहा? कलर चेंज करो. डॉक्टर देवेंद्र बोल रहे कलर चेंज करो. हाइलाइटर में यही खाली कलर है. So if I draw this, ये better दिख रहा? ये बहुत अच्छा दिख रहा है. ठीक है. So that is the central sulcus. This is the pre-occipital notch to the parieto-occipital sulcus. This is the lateral sulcus. So now I draw an imaginary line from the lateral sulcus to the midpoint of this sulcus. So we have now, the brain has been divided into 4 parts: frontal, this is the parietal, this is the temporal lobe, and this is the occipital lobe, right? So this is the way we divide the cerebral hemisphere into all these lobes. So this is what they've shown here. So you bring it down this line to the imaginary line like this, and this you extend to the midpoint of this. So this is the temporal lobe, the parietal lobe, the frontal lobe, the occipital lobe. Similarly, if you extend it onto the medial surface, we'll have this part. We just bring it to the medial surface, we'll have this same kind of picture. And you see this portion, this is the occipital lobe, which is for visual. The temporal lobe is mostly for auditory, and frontal and parietal will be discussing. So these are the sulci and gyri that we have already discussed. Now this is the medial surface. Now if you look at the medial surface of the brain, now look at this part. This is a bundle of white matter out here. A bundle of white matter, which is called the corpus callosum, joins the two cerebral hemispheres in the midline. Okay. So it joins it. So otherwise the cerebral hemispheres are free from each other throughout, excepting this part where I've just marked it with red, which is called corpus callosum, a bundle of white matter. It's just a bundle of white matter having fibers which are commissural, means they are communicating with each other, forming commissures. What do we understand by commissures? Commissures are communicating. So they're communicating with each other. That means they're sending information from one side to the other side. That's called commissural fibers. And in between this, then what? They're just hanging. We have this big fold of dura, which would be lying between these two. That's called the falx cerebri. And between the cerebrum and the cerebellum, horizontally out here in this gap, we have the Tentorium cerebelli, while in this gap we have the Falx cerebri. Is it clear? That's why I'm drawing, because you are not able to hear properly. So this is the undersurface of the brain. So the brain, the main arteries which are supplying the brain will be the internal carotid artery. You've done the common carotid artery. You've studied about the branches of the external carotid artery. The internal carotid artery, you just have learned that it enters the carotid canal, emerges from the bony carotid canal, and near the foramen lacerum, it will be lying close to the sella turcica, or we say in the medial wall of the cavernous sinus, and gives rise to the central. That's what you've just done till now. So internal carotid artery will be doing the branches. Later on is the major blood supply anteriorly, while posteriorly it's the vertebral artery. So the vertebral arteries, where are they coming from? From the first part of the subclavian artery, entering the foramen transversorium, and they join. The two arteries would be joining together to form an artery which is called the basilar artery. So this basilar artery is present on the pons, and they are the ones which form a circle out here. So the branches of the vertebral artery, that's the branches of the vertebral, which will be uniting to form the basilar, which would be dividing again into the posterior cerebral arteries or posterior inferior cerebral arteries, which will be giving rise to a branch out here, which is called the posterior communicating branches. And the internal carotid divides into an anterior cerebral and a middle cerebral. We'll be doing them in detail, so do not worry. And these would be communicating out here by an anterior communicating artery. This entire thing forms, or entire branches form a circle out here, which is called the circular filus. So now for the today, just remember internal carotid and vertebral artery branches are supplying the brain, and they form a circle of arterial circle on the inferior surface, which is called circular filus, and they give branches to supply various parts of the brain. We'll be doing that later on, because these arteries, final arteries which will be coming out, will be end arteries. We'll be doing them later. So this is the medial surface, and as I've told you, if you look at nervous system, these are MRI pictures. This is a gross picture. This is an MRI picture. So a person who wants to become a radiologist has to have very good anatomical knowledge to understand or interpret these MRIs. They are exactly like gross pictures as we see in the dissection hall. When we take out a brain and show the structures, you see them exactly like that. So this part that you bundle that you see, this is the corpus callosum. This is the medial surface of the brain. So you can see this is the medial surface of the brain. And here that you see this black, this is fluid filled. This is called the lateral ventricle. Out here you can see a thin sheet of membrane. This is called the septum pellucidum. It's a curtain which is actually separating the two lateral ventricles from each other. We'll do them in detail later on. Now this part that you see, this is the from the posterior surface of the medulla that we see. This is the medulla oblongata. This is the part of the pons, and this is part of the midbrain. Midbrain posteriorly has 4 swellings, which are called the colliculi, superior colliculus and inferior colliculus. From the superior colliculus emerges the 3rd cranial nerve. From the inferior colliculus emerges the 4th cranial nerve. Right? So from here we'll have the 3rd cranial nerve. From here we would have the 4th cranial nerve. So this is what you just remember now. And this is the part where you'll have a swelling out here, which is called the facial colliculus. A swelling formed by the nerve. This cavity that you see out here, this is the floor of the 4th ventricle. We'll be doing them gradually, which is forming the roof of this is formed by the cerebellum, while the floor of the 4th ventricle is, so the among these fluid filled cavities, the 4th ventricle is the widest, is formed. So this is to give you a exact idea what it looks like. So if I remove this pons and medulla, this is the dorsal surface of the pons. Pons means a bridge. It forms a bridge, and you can see how the fibers are. This is the medulla. This is the pontomedullary junction. And between the cerebellum and the pons and medulla, we say cerebellopontine angle. This area. This area. Now, this part would be the crus cerebri, where we have the 2 peduncles of the midbrain. So this is called the interpeduncular fossa. This is the medulla oblongata. So this is an anteromedian fissure in the center, and you can see we'll be discussing the structures gradually as we go one by one to each and every structure. We'll be doing them separately with you. And this is just a revision to show you the Falx cerebri. So now you can easily see how the Falx cerebri is lying between the 2 cerebral hemispheres, with the superior sagittal sinus superiorly, the inferior sagittal sinus inferiorly, 2 communicating with each other by the straight sinus. And this is the area where we have the confluence of sinuses, right? And this part is the tent-shaped structure between the cerebrum and the cerebellum, where we have the Tentorium cerebelli. So the transverse sinuses coming on the right side, on the left side will continue as the sigmoid sinus, and then emerge as the internal jugular vein. So we will be, and these are the tributaries which are coming into it. So these are the spaces here. I'll be doing them in detail when I do spinal cord tomorrow. One is dura mater, arachnoid matter, and pia mater. So the middle one is the arachnoid. Above the arachnoid is the dura. So if I say this is the arachnoid, above the arachnoid is the dura mater, and below the arachnoid matter is the pia mater. Now look at this. So between dura and arachnoid, this is below the dura, so this is the subdural space. This is the subdural space. Dura and above is epidural space. And between the arachnoid and the pia, this is the subarachnoid space, where we have the cerebrospinal fluid. So these are the coverings of the brain. The outer layer is called the meningeal. The dura mater has 2 layers in the cranial cavity, an endosteal layer and a meningeal layer. So the meningeal layer, when they form the folds, are forming the Falx cerebri. 2-layer folds in which they are lodging the venous sinuses are the Falx cerebri, the Tentorium cerebelli, and the Falx cerebelli. So there are two layers, and the one is called the endosteal layer in the skull. While here we do not have any endosteal layer, there are only the meningeal layer which is present in the spinal cord. So you can see the three layers out here. Then the pia layer is intimately related to its covering. So when we see a brain with the pia matter, it will be looking like a thin, glistening polythene. When we strip it off from the brain matter, from the surface of the brain looks rough. You can see thin blood vessels through the pia mater, while the arachnoid and the dura, that is the area where we have fluid filled spaces, which are the cerebrospinal spaces. So injury to this, if there is injury, bony injury, it can cause hemorrhage. If there is hemorrhage above the dura, we call it epidural hemorrhage. If it is below the dura, we call it a subdural hemorrhage. So here you can see this is the subdural hemorrhage. This is an epidural hemorrhage, and this is an hemorrhage which is taking place inside the brain tissue. It's an intracerebral hemorrhage. So one has to understand that there can be three types of hemorrhages: an epidural, a subdural, or an cerebral. So direct trauma, it can lead to epidural, torn vessels, torn this thing. It can lead to subdural hemorrhage. It can lead to anything. If there is a blow from below, also with jerk, because the brain moves, there is fluid, there is a rupture of these blood vessels and torsion of the brain. Because the brain cavity is rigid, it causes these kind of injuries, which have to be, so one always has to observe these patients. So look at this. So from this picture, you would be able to tell me whether it is a subdural or it is a epidural hemorrhage. It's between the endosteal and the meningeal layer. So this is a epidural blood clot or hemorrhage. And look at it, because of this space occupying fluid, the ventricles have got shifted. Similarly, this is below the two layers. So this is a subdural hemorrhage. And you can see similarly, these pictures can be interpreted from the MRIs. So the CSF is the fluid which is present in these ventricles or these cavities, and also present in the central canal of the spinal cord, and also it is present in the subarachnoid space. The place of formation is the choroid plexus. Choroid plexus are, so in these ventricles, they are blood vessels, and these blood vessels are covered by thin layer of pia mater and ependymal cells, where they form these bunches which form the choroid plexus, which secrete fluid. And this fluid which is secreted are called CSF, which has the sodium potassium is equal to blood plasma, but the glucose is half. So if we say that in a blood sugar of our plasma is 80 to 100, here it will be 40. The pressure also is much low. It's about 60 to 100 millimeter of water. That in biochemistry also they'll be telling you. So it's very important to understand this. I'll be doing them again when we do spinal cord. So you try to see this. So CSF, once it's secreted from these choroid plexuses, it comes out into the ventricles, the lateral ventricle. Then we have in the brainstem, we have the third, in the diencephalon. The two ventricles of either side communicate with each other. We have the third ventricle. In the brainstem, pons and medulla, we have the fourth ventricle, and this would continue as the central canal of the spinal cord, which has got fluid at the brainstem. That's at the pons and medulla. Near the fourth ventricle, there are cisterns in which the CSF comes out and covers the entire outer surface of the brain lying in the subarachnoid space, and they would be circulating throughout the subarachnoid space, also in the spinal cord. So there is fluid would be going throughout, bathing the entire central nervous system and the brain and the spinal cord with the CSF. And as CSF is being formed, more and more CSF as it's being formed, it has to also get absorbed, and absorption is by these arachnoid granulations, which you have seen near the superior sagittal sinus, near the sagittal suture of the parietal bone. So they are the ones which have villi-like processes, so they keep absorbing the extra CSF, goes back into the bloodstream through the veins, and formation is through the choroid plexus present in the lateral ventricle and the roof of the third ventricle, which would be forming the choroid, the CSF. So these are pictures which we've already shown, and this I just wanted to show you. See how fiber bundles, what they are doing. So they are coming down to the spinal cord like this. Projection fibers that you saw was a commissural fiber, and in the brain there are these deep-seated nuclei which are present. These are part of the basal. This is the part of the basal ganglia, and this nucleus that you see, this is the part of the thalamus. So thalamus, the basal ganglia, deep-seated nuclei of the cerebrum, the caudate, and this lentiform nucleus. We'll be doing them. I'll be doing this tomorrow with you. These are showing you MRI angiograms, that how well this circular villus can be seen. And from tomorrow we'll do the spinal cord. I'll start with the spinal cord tomorrow. Questions? What roll number 15 has some questions? No questions. कुछ है? कुछ नहीं. Okay, so I just want to see. So 227 students attended. Anyone wants to say anything? Anyone wants to say anything? No?
No, ma'am.
Okay. Could you hear? Little bit at least?
Yes, ma'am, most of it.
Most of it. Okay, so who's Gauri speaking?
Yes, ma'am.
Right then. Okay, so tomorrow morning I'll do spinal cord with you, and hopefully we'll have better net tomorrow.
Yes, ma'am.
Right. Okay.